Welcome back to Bloom. When we hear psychiatric evaluation, we often think of extreme mental illness. But there are benefits of getting evaluated for common mental health issues. Joining us today is Bernadette Ackerman, a psychiatric nurse practitioner. Welcome to Bloom, Bernadette.
Thank you, Gail. It's nice to be here.
Oh, it's great to have you. And this is so important to talk about, especially now, because we are coming out of a whirlwind of a year, and a lot of people are experiencing anxiety and depression. And it begs the question, when is it appropriate to get a mental health screening?
Well, really, one of the main issues that we look at and the time to get some kind of intervention is when your symptoms start affecting how you're functioning. You know, all of us have those ebbs and flows of depression and feeling really good and then kind of anxious about things that need to be anxious about. You know, without anxiety, we wouldn't really be able to function. So all of those emotions have their place. But when we start not being able to maintain the things that we do on our daily basis, not being able to sleep, not being able to eat, not being able to get up and go to work in the morning, not showering, not brushing your teeth, you know, all of those kinds of issues, and your relationships too, when your relationships become affected, that's really the time to kind of say, well, maybe I need to do something before it gets any worse.
So when you go for a psychological evaluation, what exactly does that entail? Like, how does a screening like that work?
So it's basically an interview like we're doing right now. And it's really the provider, such as myself, just collecting all of your data, and in an interview session where I just ask you questions about how you got to where you are right now, where do you live, what's your situation, what kind of stressors you may have in your life. A lot of people, you know, with COVID were just very much responding to the fact that they had to isolate when they were not used to doing that. A lot of the people that had phobias about germs, that kind of just really offset a lot of people's obsessive compulsive disorder. So it's very helpful to just know that you're going to be able to tell your story in a way that makes sense. And the provider will help you get to where you need to get. So there's really not a need to be anxious about it if you're with somebody that you can connect with and be able to just share how these symptoms are affecting your daily life.
And like you said, you and I were talking about this earlier, I would imagine the reason that some people don't seek the help that they need is because they're worried they're going to be, you know, in a judgment zone. And that's not how it works at all when you go to get mental health care.
No, not at all. Especially, I mean, people that work in mental health know exactly or close to exactly what it is that you're experiencing. I mean, a lot of people who work in mental health have been there themselves. That's why they chose that field, you know. So it really should be an environment in which you feel open and free to discuss your emotions, and you get the kind of feedback that lets you know that it is a positive experience.
So let's talk about you and your incredible background. What exactly is a psychiatric nurse practitioner?
So a psychiatric nurse practitioner, as a regular practitioner, is somebody that has they're a registered nurse, they have their bachelor's degree, and then they go back to school to get their master's degree. And for a long time, that's all you needed was to be master's prepared. But the education level is changing, and soon you're going to need a doctorate to do the same thing that I do. But hopefully I'll be grandfathered in. But basically, when you go to a nurse practitioner, it's usually a nurse that already has a lot of experience in a particular area. So like when I went back for my master's at University of South Florida, I specialize in psych. You specialize in a particular tract. And so all of your clinical work and all of your classes are based on that. So like if you went to a family nurse practitioner, their clinical rotation would be based on that specialty. So we really can't practice outside of our specialty unless we go back and get another certification.
Very interesting. We have just under a minute, but I know that you and I were talking earlier. I mean, you have like specialties in working with PTSD. You've worked with our veterans. I mean, you're bringing, you know, a lot of skill to the table. It's great to have you part of the McNulty team. Very exciting.
Thank you. I'm thrilled to be there.
And we really appreciate you joining us on Bloom today, Bernadette.
Anytime. Thank you.
And for more information, you can visit McNultyCounseling.com, and we will be back with more Bloom right after this.